Hi everyone, I'm Dr. Madhumita and you know me as MedicoMadhu. In the last video, we saw how water-soluble vitamins like A, D, E and K can trouble us when we are deficient in it and how we can handle it with our lifestyle changes as well as medications when it is needed and how to take it. In this video, we will see what all challenges we can face with vitamin B deficiency and vitamin C deficiencies, which are water soluble vitamins, and how we are going to handle it naturally with diet and also medications when it is indicated. We'll start with vitamin B1. It is called as thiamine. So vitamin B1 has a very clear-cut manifestations. It can present as dry beriberi or it can present as wet beriberi. So what do I mean by this beriberi, peri-peri and all? Basically, beriberi is a condition in which you can either have a heart involvement that is called as wet beriberi. You are severely deficient in vitamin B1 and you will develop swelling of your legs, you will become breathless, you will find mild chest discomfort, what we call as heart failure. If you're severely deficient, you can have this. The other manifestation is peripheral neuropathy, which we call as dry beriberi, because here there is no fluid overload. Your heart is not involved. Here your brain, that is your nerves, are involved. This is a part of your peripheral nervous system and central nervous system manifestation, where you will be having tingling, numbness, you will have a bit of irritability and altered sensation in your palm and in your feet. So this is the early indicator and you can immediately correct it. How are you going to correct it? By your diet, of course. Liver, pork, green leafy vegetables, fruits. These are all good sources of vitamin B1. The complicated form of vitamin B1 deficiency is called as Wernicke-Korsakoff syndrome. In this condition, you will have three manifestations. One is your eyes. It will move like a pendulum either on the horizontal plane or upwards or on the angular area. So anyone who sees you will identify that you are having some issues. Apart from that, you will have a little bit of balance issue, what we call as ataxia. The third manifestation is you will be more confused. So anytime you notice that you or someone around you has confusion, has balance issue and is also having some issues with your eyes, then it is a serious condition and it has to be treated immediately. Normally, all of us take green leafy vegetables. If we are non-vegetarian, anyway, we are going to have pork or liver or chicken or something in our diet. So when are we going to have this deficiency? Well, if you're someone who is very picky about your food, definitely you're going to develop. Apart from that, if you're taking chronic alcohol abuse or some substance abuse which is preventing the absorption, then you can have. Unlike the fat-soluble vitamins, the water-soluble vitamins don't need anything extra in your body. So it can be as long as you are eating properly, timely meal and you are taking proper quantity of each of your feed, you will not develop any deficiency. So let's say you have already developed vitamin B1 deficiency. Depending on your severity, we can go for tablet form or injectable form. Vitamin B2, also called as riboflavin. So riboflavin is easily available for you, in the sense it is available in a lot of vegetarian products itself, like almonds. If you're someone who likes spinach, if you're Brussels sprouts, or if you're someone who likes broccoli, let's say you're hardcore non-vegetarian and you want to take meat or egg, definitely you're getting your vitamin B2 from this. So who are the people who are going to be prone to this deficiency? If you're a choosy eater, of course you are. Or if you're someone who has malabsorption, if you're taking alcohol for a long time, then it is going to cause a harmful effect because you're going to have deficiency. Why did I say harmful effect? Because it's not just going to affect you, but if you're a pregnant woman, if you're a lactating mother, it's going to affect your baby as well, as it is very important for growth and development. So let's say during your pregnancy, you did not consume it properly, then your baby is prone to have congenital heart disease, or the baby can develop a cleft lip or a cleft palate. So your nutrition is of utmost importance. What are the manifestations that you can get so that you can identify it earlier? Well, there is something called as chelosis. That is basically you might have a bit of cut in the corner of your lips, or you might have a tongue soreness. You will have a red tongue. You might notice that you are having rashes in your private part. It will be a little scaly rash, or you will notice that you're fatigued all the time. You might notice numbness. You might notice irritability. All these things are early manifestations. Beware, it's not just about your baby, but even you have a tendency to develop esophageal cancer risk is slightly higher with vitamin B2, that is riboflavin deficiency. How can we treat it? Simple measures like tablets, that is oral supplement, can help you correct it. Niacin. So niacin deficiency, there are 3 Ds that are involved. One is dementia, that is forgetfulness. The second D is dermatitis, that is skin becomes scaly and it changes color. The third is diarrhea. So anyone who has memory issues, who has skin issues as well as diarrhea, please think of niacin deficiency. So, okay, you have noticed that you're developing these things. How are you going to correct it? Well, from your diet, what are the things that you can take? Definitely, you can include avocados in your diet. You can take peanuts. You can go for more of like, poultry. You can take fish. You can even go for any red meat. All these are actual good sources of your niacin. So despite taking that, you're noticing that you are having a little bit of spasticity, that is tightness of your limbs, or your balance is getting disturbed. That means you are progressing further. So in this case, immediately you need medical attention. So kindly go and visit the doctor. They will give you your niacin supplement. Vitamin B5, also called as pantothenic acid, usually deficiency does not occur at all because it is present in whole grains, it is present in meat, it is present in avocados, it is present in vegetables, it is present in fruits, seeds, nuts, name it, anything and everything actually has vitamin B5. Then who are the people who can actually develop? Basically, if you're someone who is taking oral contraceptive pills, or if you're someone who is an alcoholic, or let's say you're someone who has been having some chronic illness, or you're an elderly who is not able to eat at all, only in these people it is noticed. Immediately, anyway, you would be coming for medical attention because of the chronicity. So we will be starting you on supplement. How do you present? Well, your symptoms are not specific at all. You would present with lethargy, you will have sleep disturbance, you will feel tired, fatigue, you will even have memory loss, you will have irritability. So it is all non-specific symptoms. It is only based on your other history that we pick it up and we put you on vitamin B5 supplement. Vitamin B6 deficiency or pyridoxine deficiency. So this is seen in people who have irritable bowel disease, who have decreased dietary source or decreased absorption, or if you have had alcohol consumption for a pretty long time, then that can also cause. If you have some autoimmune disorder, if you have a kidney disease, then, or if you're someone who is using antibiotic for a long time, then you can develop vitamin B6 deficiency. Vitamin B6 deficiency usually presents with numbness, tingling sensation, or you might have a swollen up tongue, or you might have skin rashes, you might notice crack in your lips. All these things are the common manifestation. Apart from this, your immunity might decrease, so you might have repeated infection, or you might even have some neurological discomfort like a little bit of irritability, forgetfulness. These are the common features. Well, pyridoxine is given even in pregnancy to prevent excessive vomiting. So, who are the people who are going to require the supplements? Basically, those who do not consume the dietary sources. So, what are the dietary sources? It includes pork, it includes banana, it includes milk, it includes oats, it includes peanuts, soya beans. These are all common sources that are rich in vitamin B12. So, majority of us take it in our normal diet. So people who have a little bit of issues with absorption are the ones who are going to develop this deficiency. Once they develop deficiency, they can try to correct it with diet. If it is not happening, then we can of course go for medication, which would be in the form of tablet. Vitamin B7, also called as biotin. There is no dietary source per se. It is from your intestine. The bacteria produce the biotin in your body. So majority of us don't develop any deficiency at all with biotin. Biotin is very important for your skin, for your hair, for your brain development, for your DNA synthesis, all these things. So who are the people who are going to be deficient? Well, if you're someone who has been having a small bowel issue, or if you're someone who has been taking like anticonvulsant, that is if you have fits or seizure disorder and you've been on medication, or let's say that you're trying to build up your body and you're taking lot of raw eggs, then you are at a risk of developing biotin deficiency. So if you are being diagnosed with biotin deficiency, we'll be putting you on tablets for it. Vitamin B9, also called as folate, and the derived form that is available as tablets is called as folic acid. Majority of us must be knowing about folic acid because it is given prenatal to pregnant women, and even those who are planning a pregnancy, we give them 3 months prior. Why is it given? Because it is very important for the neural tube development in the baby. So that is the reason we are giving it. So from this you have understood that it is very important for the cognition, that is for the brain. So the manifestations of course are going to be related to it. Like for example, you might present with dementia, there is forgetfulness, you might have irritability, you might also have other manifestations like skin changes, you can have hyperpigmentation of the skin, or you can be presenting with anemia, that is your hemoglobin will be on the lower side. So what are the sources that are available? Of course, the commonly available ones like broccoli, you can use Brussels sprouts, you can also take any green leafy vegetables, they are rich in it. You can also go for meat, again it's a rich source. So folate is given as a supplement, one prenatal. Second, if we notice that you have megaloblastic anemia, that is you have big size cells and you have anemia, low hemoglobin, we'll be supplementing you. Usually vitamin B12 and folate would be given together. Reason being they complement each other. If it is not given together, then it can result in neurological complication worsening further, because you need methylcobalamin, that is vitamin B12, for your folate utilization. Vitamin B12, what we know as methylcobalamin, here the deficiency can occur if you are a vegan, because the dietary sources actually includes milk products. If you're someone who takes eggs, or if you're taking red meat, poultry, etc., you're not going to have vitamin B12 deficiency. Vitamin B12 is mainly related to your hematological, that is your blood cell system, and also with your neurological system. So the symptoms and signs are going to be related to that. You will present with anemia, that is low hemoglobin. You will be having some skin changes like light yellowish tinge of your skin. You will have a raw beefy tongue, or you might be noticing that you are having tingling sensation, numbness, you're becoming more forgetful, you're having a bit of balance issue, or you are becoming more irritable. It is all because of vitamin B12 deficiency. So how are we going to treat vitamin B12 deficiency? Again, it depends on your severity. We will first check whether it is because of malabsorption or because you're not taking your food properly. If it is malabsorption or any other cause that is related to it, then we will be treating that along with the injectables so that your vitamin B12 levels are normalized. If it is only plain deficiency, then again depending on the severity, we will choose whether we have to give you injectables or just tablets. Vitamin C, also called as ascorbic acid. So vitamin C deficiency can result in a condition called as scurvy. Why does it occur? One, because of your reduced intake of the sources. The common sources are your citric fruits like lemon, berries, they are all good sources. Apart from that, you can take broccoli, you can take cauliflower, these are all good sources. Let's say that you're taking your diet source properly, but despite that you're noticing deficiency, then please check if you're smoking too much or if you're taking alcohol too much. These two can impair, or if you're someone who is taking iron supplement, then that can impair your vitamin C absorption. So that's the reason we tell you to take it in empty stomach or in the night after your food, so that the absorption is not affected. How are you going to identify if you're having one? Well, you will have gum bleeding, you will feel extremely tired, you will have muscle pain, you will have body pain, you will have skin changes, you will have skin rashes, bleeding from any part of your body, the wound will not heal, you will have poor wound healing, All these things indicates that you have vitamin C deficiency. So to improve your vitamin C, one dietary supplement is definitely needed. Apart from that, we will be putting you on supplement based on your requirement. We will be treating you. So with this, we come to the end of vitamin deficiencies. From the whole discussion, you would have understood that as long as we eat properly and we keep moving around and we don't have habits like smoking or alcohol, we can improve the absorption, we can improve the intake, as well as we can prevent deficiencies. I'll meet you with many more interesting videos like these. Kindly follow me and subscribe to my channel for more health awareness videos.